Hey guys, welcome back to my channel, The ENT Resident. Today I'll be talking about 3 signs in ENT which can sound very confusing. And these are the Bocca Sign, Boyce Sign and Bryce Sign. We'll talk about where do we see it, what is this sign exactly, what kind of a sign is it, what is the reason behind seeing this sign. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. Our first sign here is the Bocca sign. Now, what is it that we are seeing here? So, Bocca sign is actually a clinical sign that we usually elicit by palpation during the time of neck examination. What is it exactly? We see an absence of the laryngeal crepitus on palpation of the larynx. So normally when you're examining the larynx, when you move the larynx from side to side over the cervical spine, you feel a grating or a crackling kind of sensation. And this sensation that you're feeling is actually the laryngeal crepitus, and this has a name. This is known as the Muir's crackle. This is a normal sensation and this is a normal finding. But what happens is, if this laryngeal crepitus is absent, that is when the larynx feels to be fixed or immobile. And this is what is known as Bocca's sign. Why does this happen? So we know according to the anatomy of larynx that there is a retropharyngeal space behind it. So when the retropharyngeal space gets lost, the larynx cannot glide freely anymore over the vertebral column. That's when you see that there is no laryngeal crepitus to be found when you're trying to move the larynx from side to side. So essentially, the retropharyngeal space is getting lost. Now, what are the conditions where we see Bocca's sign? That will be typically conditions which end up obliterating this retropharyngeal space. So, number one can be a case of malignancy. The most classic association of Bocca's sign is actually with that of post-cricoid carcinoma. And here the retropharyngeal space gets lost because of infiltration or fixation. Second, you can also see this in case of infections and abscesses. Especially, you will see it in prevertebral abscess and also in retropharyngeal abscess as well. Here, the collection of the infective material in the retropharyngeal space will obliterate the laryngeal crepitus. Third, this can also happen in lymphatic or mass lesions, like if there is some retropharyngeal tumors or if there is retropharyngeal lymphadenopathy. And lastly, you can also see this in TB of the spine, where you see a pot spine where the cervical vertebra gets involved. So these are all the situations in which the retropharyngeal space will get obliterated, and therefore when you examine the larynx, there will be an absence of laryngeal crepitus. This sign is actually an eponym, and this was named after Bocca, who was the first one to describe the diagnostic significance of laryngeal crepitus in post-cricoid and retropharyngeal pathologies. So it's important to differentiate between two things over here. One is the term Muir's crackle, which is basically the presence of normal laryngeal crepitus, whereas when you lose that crackle is when you call it as Bocca's sign. So this is what Bocca's sign is. Next, we move on to discuss the Boyce sign. Now, Boyce sign is also a clinical sign that you elicit during the time of neck palpation. But what happens here? Here, we are hearing a gurgling or a splashing sound when we are palpating the neck. This happens because of fluid and air in a pharyngeal pouch, also known as Zenker's diverticulum. So, what is it that happens here? In a patient who has a large Zenker's diverticulum, there is a collection of food as well as fluid inside this pharyngeal pouch. Now, when you are palpating the neck, then this usually, if you are palpating on the left side, these pouch contents kind of get displaced. And as they get displaced, because of the presence of both food and fluid, it produces this gurgling or a splashing sound over there. And this is an audible gurgle, and this is known as Boyce sign. And we see this in a Zenker's diverticulum or a pharyngeal pouch. This sign was named after Boyce, who was the one who described this characteristic gurgling sound produced by the retained fluid inside the pharyngeal pouch. Now, some MCQ question in relation to this is, can you tell me the best investigation that you can do for the Zenker's diverticulum? That is a barium swallow. A Zenker's diverticulum patient will usually come to you presenting with dysphagia. They'll also talk about regurgitation of undigested food material. They can also come to you with aspiration cough and halitosis. So this is a little bit about Zenker's diverticulum and the sign that we see in it, which is the Boyce's sign. Now, another sign that we very commonly confuse because of the name is the Bryce sign. Now, Bryce sign is also a clinical sign that we see during the time of neck examination. Here, what is happening is this is not related to Zenker's diverticulum. This is related to laryngocele. Here, when you compress an external laryngocele, it causes a hissing sound because of the escape of air into the larynx. This condition is typically seen in an external laryngocele and a combined laryngocele, but never in an internal laryngocele. So let's try to understand what happens here. So in an external laryngocele, basically what we have is, if this is the larynx, we have an air-filled sac which is communicating with this laryngeal lumen over here. Right? So this is what an external laryngocele looks like. Now, this is basically an air-filled sac. So now when you're trying to demonstrate the Bryce sign, you are basically compressing on this swelling over here. Now, on manual compression of the swelling, what happens is the air escapes from this laryngocele over here back into the airway lumen, and it produces this typical hissing or gurgling sound that you hear. So the raised intralaryngeal pressure is responsible for filling the laryngocele with air, and when you compress the laryngocele, the air goes back into the larynx, producing a hissing sound. And this is what we call as Bryce's sign. Now, the reason why I said that you'll be able to see this in an external laryngocele and a combined laryngocele, but not in case of an internal laryngocele, because the internal laryngocele, it does not have a compressible neck swelling. That is the more internal laryngocele. Whereas combined laryngocele is a combination of external as well as internal laryngocele. So we need basically an external compressible neck swelling to be present to be able to demonstrate this sign. So this is a feature of external laryngocele and combined laryngocele. And a very important MCQ question that you can be asked here is, can you tell me some predisposing occupations in which we see the development of laryngocele in? The typical answers over here should be trumpet players and glass blowers. So that's about Bryce's sign. So we do not have any confusion here. So we had 3 signs today. We have the Bocca sign, Boyce's sign, and the Bryce sign. Bocca sign was basically the absence of laryngeal crepitus, which we see in any case which has obliterated the retropharyngeal space. Boyce's sign is seen in the pharyngeal pouch, where when you try to palpate the neck, there is a gurgling or a hissing sound because of the movement of the air and food and fluid inside the pharyngeal pouch. And third one was the Boyce's sign, which we see in case of laryngocele. When you compress the neck, the air inside the laryngocele goes back into the airway and causes this hissing kind of sound. I hope you have understood this, and if you have any doubt regarding this, please note them down in the comment section and I'll get back to you. Thank you.